More than 350,000 Americans have now died from COVID-19. The president calls that total, quote, far exaggerated.
There are still a lot of conspiracy theories out there about how COVID deaths are counted. So Amanda Quintana shows us just how COVID ends up on a death certificate.
It's pretty rare for a death certificate to say just COVID-19. There are often multiple causes of death listed, things that were caused by the virus and contributed to the death.
The proximal cause of death might say pulmonary embolism or blood clot in the lung, COVID-19. Now, if that person didn't have COVID-19, they never would have died from a pulmonary embolism.
Dr. Jeff Pothof at UW Health says it's a similar story with other causes, like heart attacks. It might be listed first on a death certificate, but if COVID caused that heart attack, COVID will also be listed. In Wisconsin, healthcare providers are then required to report it through an online system called WEDS, and that's how it ends up on DHS's death count.
Every death that we report is a report of a clinician in a hospital or a medical examiner who has made a determination based on the clinical evidence that a person's death was in part or mainly due to COVID-19.
If someone got hit by a train, I don't think any of us would say, well, it's their obesity that killed them, right? It was the fact they got hit by a train that killed them. So it's kind of similar where you say, someone had high blood pressure, they died from that, not COVID. It just doesn't hold much weight.
Pothof says doctors can tell if someone was at risk before or if it was COVID that brought on these new issues. And they're actually using death certificates to learn more about the virus.
So then we start thinking about treatment strategies that might thin the blood so that more people don't have to die of blood clots who have COVID-19.
As for the tweet from President Trump saying that the numbers in the U.S. are being exaggerated, calling it fake news, or any of the other conspiracy theories suggesting that doctors are making the virus look worse to create fear, Pothof says he can't worry about that. All he can do is tell the truth, even if it is scary. Amanda Quintana, News 3 Now.